right, this morning in today's checklist, we're going to talk about the impact that healthy eating can have on some of the most common medical conditions. Dr. Ian Smith, he's the author of Eat Your Age, Feel Younger, Be Happier, Live Longer, all things we want to do. Good morning. Welcome back, sir.
Good to see you. Thanks for having me.
And so I think, first of all, we should point out here, we're not saying that just eating these foods are going to make sure that you eliminate symptoms or side effects. Correct?
Yeah, no, absolutely. You know, for some people to alleviate some of the symptoms, foods may help. I wrote the book because people can prevent some disease and treat some disease at their kitchen table, but it doesn't necessarily work for everyone, but for a lot of people it does.
All right, well, let's start with type 2 diabetes.
Yeah.
Blood sugar controls the situation.
Yeah, so these are the 4 conditions that we want, or 5 conditions we're going to talk about. Type 2 diabetes, of course, as you know, is the inability to regulate the blood sugar levels in your blood, okay? And that can be problematic if you have too much sugar circulating for a long period of time. And we have certain things that you can actually do. So it's really about fiber, fat, and protein. And what these things do is they help slow down the digestion or the rise of the blood sugar in your system. And so avocados, they're great. They have monounsaturated fats. That's the fat part of it.
Okay.
They also have fiber. So once again, fiber, fat, protein help slow down the rise. Yogurt's great because it has probiotics, which are actually anti-inflammatory. It also has fat, and it also has protein.
Any kind of yogurt or low fat?
Full fat yogurt is good.
Okay.
Greek yogurt is excellent. Those are the kind of yogurts. The yogurts that you kind of buy with a lot of sugar in it, stay away from it. And then lastly, fish is really good for type 2 diabetes. Fatty fish. Why? Because they have omega-3 fatty acids, mackerel, tuna, salmon, great fish.
All the fish.
All the fish.
All right, I think Dylan's still
Okay,
Here we go.
let's turn now to high blood pressure.
Yeah.
Can we actually lower our blood pressure with these foods?
Some of them, yes. High blood pressure basically is that your blood is exerting too much force on the inside of your blood vessels. Mm-hmm. There's a top number and a bottom number. Both of them or one of them can be too high. That's a problem over a long period of time. So some of these foods we talk about potassium, magnesium, and nitrates. So bananas, lots of potassium. Why is potassium is important? It helps to relax your blood vessels so they're not stiff.
Okay.
When you have relaxed blood vessels, your blood pressure goes down. Leafy greens, arugula, kale, spinach, you name it, collards, they have magnesium and they have potassium. So magnesium, right, a twofer. Magnesium also can relax those blood vessels, so it's a twofer. And lastly, beets. Beets are really, really good. They're great. I love beets. They're great because they have nitrates, which get converted to nitric oxide, which relaxes your blood vessels.
Okay, now let's look at high cholesterol, which I think is surprising that you're going to include oils in here.
Yeah, absolutely. So high cholesterol, of course, a lot of cholesterol is made by the liver. Long-term high cholesterol can be very problematic for your blood vessels. But you want things like soluble fiber, like oats.
Okay.
Soluble fiber is digested, and what it does is it clogs and holds onto the cholesterol and pulls it out of your body. Vegetable oils, canola, sunflower, safflower, they're full of what are called polyunsaturated fats. They lower the bad cholesterol, the LDL.
Okay.
That's why it's important. And olive oil, too, by the way. And foods with sterols and stanols, these are things from your plant. They're plant-based compounds. They look like cholesterol, so your body wants to absorb them instead of the real
what
cholesterol.
Foods have that in it real quick?
Orange juice, things are fortified too, by the way. Yogurt, milk, all kinds of plants, fruits, and vegetables that have sterols and stanols.
Okay. All right, cool.
So, Doc, I don't think about food when I think about, like, say, those mood kind of things, depression, anxiety.
Yes.
But you say you can actually help alleviate those.
Well, anxiety, 40 million Americans suffer from anxiety. It's the #1 mental illness. It goes hand in hand sometimes with depression. Half the people with depression have anxiety, so they have similar biological mechanisms. So there's certain types of foods that can help your mood. Zinc-rich foods, things like oysters and liver and cashews, that's because they control something called serotonin or GABA, which are your mood busters. High fiber grains, oh my goodness, bulgur, whole wheat pasta, whole wheat grains.
And what's a B12 rich
And
food?
a B12 would be things like clams, mussels. All these things, by the way, can help you feel better and increase your mood.
Dr. Ian Smith.
Yeah, this is very helpful.
Food can heal.
Food can heal, which is why you got to eat your age.
Thank you so much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.